What your armpit tells about your health. 10 warning signs. Hello and welcome back to our channel. Today we're going to explore a topic that might surprise you but is vital for understanding your body and health. We usually don't pay much attention to our armpits unless it's about hygiene. But did you know that this often overlooked part of our body can tell us a warning sign about our health? Yes, that's right. According to the Cleveland Clinic, the armpits are a common site for skin conditions and can be an indicator of underlying diseases such as diabetes or autoimmune disorders. Get ready to learn about symptoms such as body odor, lumps, lymph nodes, visible veins, and many more. Keep watching as we uncover 10 warning signs your armpits may be revealing about your well-being. Just a quick reminder, this video is intended solely for educational purposes. If you have any medical conditions, please consult with your doctor. Now, let's get started. Significant changes in the size or shape of the armpit area could indicate the presence of unusual growths or swelling, necessitating a medical evaluation. These alterations might manifest as visible lumps, noticeable enlargement, or even asymmetry between the two armpits. Such changes could stem from benign conditions like cysts or lipomas, which are non-cancerous and often harmless. However, they could also signal more concerning issues, such as lymphadenopathy or tumors, which require prompt medical attention. Observing these changes early and consulting with a healthcare professional can lead to earlier diagnosis and treatment, potentially improving outcomes. Have you suddenly noticed a change in the way your armpit smells? No, I'm not talking about the usual post-gym funk. I mean a distinct shift in your body odor. The armpit can be a window into overall health, remarks Dr. Jane Smith, a respected dermatologist. This could point to something as simple as a new diet, rich in foods like garlic or spices, but it might also signal hormonal imbalances such as hyperthyroidism. It could even be due to metabolic changes if you're undergoing medication shifts or if there are other underlying health issues. A metallic smell, for instance, might be a result of liver or kidney diseases. Certain infections or bacterial growths in the body can also manifest through unusual body odors emanating from the armpits. In particular, diabetes patients might notice a sweet or fruity smell due to ketone production. It's essential to pay attention to these signs and consult a healthcare provider for a proper diagnosis and treatment plan. That occasional bump under your skin after shaving can be normal, but a persisting lump, especially if it's growing or doesn't lessen over time, can be an alert shrouded in your armpit. These could be benign cysts or fibroadenomas, but they might also suggest more ominous health issues such as tumors or lymph node inflammation. Swollen lymph nodes could indicate infections like mononucleosis or immunological conditions like lupus. Pursuing medical evaluation for a persisting lump or mass in the armpit area is essential, as this could potentially signal breast cancer or other serious conditions. Although the armpit is not the most common site for breast cancer to manifest, cancer cells can travel to the lymph nodes, making any unusual lump a matter of concern. Additionally, these lumps can vary in texture and mobility. For instance, a hard, immovable lump might indicate a more severe condition than a soft, movable one. However, only a healthcare professional can accurately diagnose the cause of a lump through examinations and possibly imaging tests or biopsies. Before we go to the next sign, we want to remind you to hit that subscribe and like button if you haven't already. Your support helps us continue creating valuable content for you. Enlargement of the lymph nodes beneath the arm can sometimes be felt as a tender or firm area in the armpit. While often associated with transient infections like a common cold, persistent enlarged lymph nodes that are firm, fixed, or painless could indicate more grave illnesses such as lymphoma, leukemia, or metastatic cancer. Enlarged lymph nodes, while at times a sign of minor infections, merit close attention when they persist or display characteristics unusual for simple inflammatory responses. Such lymph nodes may not only feel different to the touch, but can also be indicative of the body's attempt to fight off more serious infections or to react to conditions where the immune system is compromised. For example, in autoimmune diseases like rheumatoid arthritis or HIV/AIDS, the lymph nodes can become significantly enlarged as the body reacts to its internal state of imbalance. Additionally, in diseases such as lymphoma, the lymph nodes themselves are the primary sites affected, leading to their noticeable enlargement. It's crucial to understand that while some causes behind enlarged lymph nodes are manageable or even treatable, others require immediate medical intervention to address potentially life-threatening conditions. Therefore, ongoing monitoring and consultation with healthcare providers are essential for anyone experiencing this symptom. While a little rash now and then might not stir concerns, persistent changes in the skin of your armpit can be a cause for alarm. Discoloration, a lasting rash, or skin that's suddenly ulcerated without reason could suggest more than just skin irritation. For example, certain types of skin cancer first appear as subtle changes in the skin, making the armpit a potential early detection zone for serious dermatological issues. It's also important to consider the texture and thickness of the skin in your armpit area. An increase in skin thickness or a bumpy texture may indicate underlying health conditions such as lymphedema, which can arise from blockages in the lymphatic system or after certain medical treatments like surgery or radiation. In some cases, the presence of dark, velvety patches in the armpits could be a sign of insulin resistance, a condition related to type 2 diabetes known as acanthosis nigricans. Early detection and management of these skin changes are crucial for addressing any potential health issues effectively. Armpit pains can often be discounted as muscle overexertion or superficial scrapes. However, persistent pain without an obvious cause like injury or strenuous activity calls for attention. This discomfort could be rooted in issues ranging from soft tissue injuries, nerve problems, or even referred pain from breast conditions. Furthermore, in some cases, the pain or discomfort experienced in the armpit area may be due to less common yet significant health concerns such as lymphedema. This condition, often associated with cancer treatments that involve lymph node removal or damage, leads to fluid buildup and swelling, causing discomfort. It's also important to consider unusual causes like hidradenitis suppurativa, a chronic skin condition that affects areas bearing sweat glands, including the armpits. This condition can produce painful lumps beneath the skin and can significantly impact an individual's quality of life. Hence, understanding the underlying causes of armpit pain or discomfort is crucial for effective diagnosis and treatment, highlighting the importance of not overlooking such symptoms. An ache or sensitivity to the touch could seem insignificant, but when it becomes a constant experience, it's essential to investigate. Persistent tenderness could point to infections or inflammations indicative of larger health complications, including breast infections, especially in nursing mothers, underarm folliculitis, or health concerns extending from nearby tissues. Tenderness might be one of the early signs of a developing infection or inflammation, necessitating a closer look at one's health habits and potential exposure to irritants. Products such as deodorants or antiperspirants, often part of daily hygiene routines, can lead to skin irritation or allergic reactions, manifesting as tenderness or discomfort in the armpit. Additionally, tenderness may also suggest underlying systemic conditions such as diabetes, where skin sensitivity and susceptibility to infections are increased. Now, onto something a lot less subtle, bruising or bleeding in the armpit area. Unusual bruising could be a sign of clotting disorders or even platelet issues and underlying blood disorders. When bruising or bleeding appears without a clear cause, it's a warning sign that should never be ignored. This symptom could herald more serious conditions such as hemophilia, where the blood doesn't clot properly, or von Willebrand disease, a more common but lesser known clotting disorder. Additionally, bruises that are larger than usual, persist longer than expected, or occur alongside symptoms like fatigue and weakness could indicate an underlying issue with the bone marrow, such as leukemia. Consulting a healthcare professional upon noticing these symptoms is crucial for early diagnosis and treatment, underscoring the importance of paying close attention to one's body and the signals it sends. Visible veins that suddenly appear more prominent or swollen in the armpit area can often be an alert to potential health issues that shouldn't be dismissed. These could indicate lymphatic blockage or the presence of tumors that are not yet palpable. In certain cases, such changes may also suggest an increase in blood pressure or alterations in the body's ability to regulate fluid, pointing to conditions like deep vein thrombosis, DVT, or other circulatory system disorders. It's essential to monitor these symptoms closely and consult with a healthcare provider to rule out serious conditions. Early detection of these signs can lead to timely intervention and treatment, possibly preventing more severe health outcomes. Last but not least, skin rashes or irritation in the armpit area can have various causes, ranging from allergic reactions to hygiene products such as deodorants and soaps, to more serious conditions like dermatitis or fungal infections. It's crucial to observe the characteristics of the rash, whether it's itchy, scaly, patchy, or discolored, as these details can provide valuable clues to the underlying issue. In some cases, a simple change in personal care products or wearing loose-fitting clothing made of breathable materials may alleviate the symptoms. However, persistent or worsening rashes warrant medical attention to identify potential infections or autoimmune disorders. Thank you for sticking around. If you found our video interesting, I invite you to like, subscribe, and check our other videos on health and wellness.